choice questions focused on non-typhoidal Salmonella spp, excluding S. typhi, with 5 answer choices, the correct answer, and rationale for why the other choices are incorrect, all based on the summary you provided. Hat question 1, reservoir and transmission. A 10-year-old boy develops watery diarrhea after handling a pet turtle. Which of the following pathogens is the most likely cause? A. Campylobacter jejuni. B. Salmonella, non-typhoidal. C. Escherichia coli ETEC. D. Shigella dysenteria. E. Giardia lamblia. Salmonella non-typhoidal. Why not the others? A. Associated with undercooked poultry, not reptiles. C. ETEC causes travelers diarrhea, no reptile link. D. Shigella spreads via a human fecal or oral route, not animals. E. Giardia is waterborne and causes greasy stools, not linked to pets. Question 2. Antibiotic use. A 23-year-old immunocompetent adult has a self-limited bout of diarrhea after eating undercooked chicken. Stool culture grows non-typhoidal Salmonella. What is the most appropriate management? A. Ciprofloxacin. B. Azithromycin. C. No antibiotics, supportive care only. D. Metronidazole. E. Trimethoprim sulfamethoxazole. Correct answer C. No antibiotics, supportive care only. Why not the others? A, B, E. Antibiotics may prolong fecal shedding in immunocompetent hosts. D. Not effective against Salmonella. Question 3. Immune response. Which immune cells are most involved in clearing disseminated non-typhoidal Salmonella infections? A. B lymphocytes. B. CD4 plus T cells. C. CD8 plus T cells. D. Neutrophils. E. Eosinophils. Correct answer D. Neutrophils. Why not the others? A. B. Adaptive immunity is important, but PMNs are first-line defense in bacterial infections. E. Eosinophils are for parasites, not bacteria. Question 4. Risk factors. Which of the following exposures is least likely to result in non-typhoidal Salmonella infection? A. Undercooked poultry. B. Raw eggs. C. Pet reptiles. D. Drinking untreated stream water. E. Contact with infected person's stool. Correct answer, drinking untreated stream water. Why not the others? A, B, C, E. All are common sources of Salmonella. D. Waterborne pathogens are more likely Giardia or Campylobacter. Question 5. Vaccine availability. Which of the following statements about non-typhoidal Salmonella is correct? A. It is controlled by a widely used vaccine. B. Humans are the only reservoir. C. Antibiotics always shorten disease duration. D. It produces hydrogen sulfide. E. It primarily invades monocytes. Correct answer D. It produces hydrogen sulfide. Why not the others? A. No vaccine for non-typhoidal Salmonella. B. Animals are common reservoirs. C. Antibiotics may prolong shedding. E. Monocyte invasion is typical of S. typhi, not non-typhoidal strains. Question 6. Infectious dose. Compared to Shigella, non-typhoidal Salmonella requires a lower infectious dose. B. No gastric acid for infection. C. A much higher infectious dose. D. Vector transmission. E. Direct blood contact. Correct answer C. A much higher infectious dose. Why not the others? A. Incorrect. Salmonella needs a higher dose. B. Salmonella is acid labile. D. Fecal oral, not vector or bloodborne. Question 7. Pathogenic features. Which virulence factor is common to both typhoidal and non-typhoidal Salmonella species? A. VI capsule. B. Endotoxin. C. Shiga toxin. D. Heat labile enterotoxin. E. Cholera-like toxin. Correct answer B. Endotoxin. Why not the others? A. VI capsule is exclusive to S. typhi. C. Shiga toxin is from Shigella, not Salmonella. D. E. Heat labile cholera-like toxins are from E. coli and V. cholerae. Question 8. Pediatric consideration. A 4-year-old presents with diarrhea and fever after eating scrambled eggs. Stool culture shows non-typhoidal Salmonella. What increases her risk for bacteremia? A. Recent antibiotic use. B. Age 5. C. Previous vaccination. D. High-protein diet. E. Hand-washing practices. Correct answer? Why not the others? A. May worsen colonization but not a strong risk factor for bacteremia. C. No vaccine available. D. E. Irrelevant to bacteremia risk. Question 9. Lab identification. Which test is most useful in identifying Salmonella on a selective medium? A. Catalase test. B. Oxidase test. C. Hydrogen sulfide production. D. Indole test. E. Urease test. Correct answer C. Hydrogen sulfide production. Why not the others? A, B, D, E, not specific for Salmonella. C, Salmonella is H2S positive, unlike Shigella. Question 10, effect of antibiotics. Why are antibiotics not recommended for uncomplicated non-typhoidal Salmonella diarrhea in immunocompetent patients? A, they do not kill the bacteria. B, they lead to antibiotic resistance. C, they increase the risk of Clostridium difficile. D, they prolong fecal excretion of bacteria. E, they are too expensive. Correct answer, D, they prolong fecal excretion of bacteria. Why not the others? A, antibiotics can kill Salmonella but are unnecessary. B, resistance is a concern but not the main reason here. C, possible, but prolonging fecal shedding is the key issue. E, cost is not the clinical concern. Would you like these questions